Hello friends, all of you are welcome to the online lecture series on drugs acting on ANS from Pharmacovigilance Academy. Friends, in the previous part we discussed classification of cholinomimetic drugs and pharmacology of acetylcholine. Today, in the sixth part of the series, we are going to talk about therapeutically used parasympathomimetic drugs. Friends, if you like the contents of this lecture, then please give us a like and subscribe to the channel Pharmacovigilance Academy. Friends, the important therapeutically used parasympathomimetic drugs are Carbachol, Bethanechol, Pilocarpine, Cevimeline, Neostigmine and Pyridostigmine. Here, Carbachol and Bethanechol are choline esters. They are the choline esters. Pilocarpine and Cevimeline are cholinomimetic alkaloids. Cholinomimetic alkaloids. These Neostigmine and Pyridostigmine are cholinesterase inhibitors. Cholinesterase inhibitors. These four, Carbachol, Bethanechol, Pilocarpine and Cevimeline, are direct acting cholinomimetic drugs or parasympathomimetic drugs. Direct acting. And these two, Neostigmine and Pyridostigmine, are indirect acting parasympathomimetic drugs. Indirect acting. These are direct acting because they are the agonist of the muscarinic receptor and they activate muscarinic receptors directly. These two are indirect acting parasympathomimetic drugs because they increase the amount of acetylcholine at the receptor site by inhibiting the enzyme cholinesterase. Friends, now let's see important facts about Carbachol. As you know, Carbachol is a choline ester. It is mainly used as miotic. It stimulates muscarinic receptors of ciliary body and facilitates trabecular drainage of aqueous humor, which result in reduction of intraocular pressure. It is used to lower intraocular pressure in glaucoma, induce miosis during surgery, and reduce intraocular pressure after cataract surgery. Eye preparations can produce systemic cholinergic side effects such as headache, watering mouth, increased sweating, increased urination, nausea, vomiting, stomach cramps, diarrhea, dizziness, feeling faint, flushing, and irregular heartbeat. Carbachol is available as ophthalmic solution for topical use with 1.5% and 3% strength, and as intraocular injection in solution form with 0.01% strength. Carbachol is indicated for intraocular miosis induction during surgery and to reduce increased intraocular pressure during first 24 hours after cataract surgery. For the adults, gently instill 0.5 ml into the anterior chamber for the production of satisfactory miosis. The solution may be instilled before or after securing sutures. Its onset of action is within 2 to 5 minutes and its duration of action is 24 hours. The second indications for Carbachol is lowering of intraocular pressure in the treatment of glaucoma. It's not for injection. Instill 2 drops topically in the affected eye up to 3 times per day or as directed. Topically, onset of action is 10 to 20 minutes and duration of action is 4 to 8 hours. Contraindications for Carbachol include acute iritis, anterior uveitis, and some forms of secondary glaucoma. Patient should be instructed that this drug may cause blurred vision and difficulty in dark adaptation. If affected, do not drive or operate machinery, especially at night or in poor light. Adverse reactions. Generally, eye-related adverse reactions are there, which may include transient symptoms of burning, stinging and irritation of eye, corneal clouding, retinal detachment, ciliary spasm, blurred vision, lacrimation, difficulty in dark adaptation, increased pupillary block, vitreous hemorrhages, conjunctival vascular congestion, sensitization of the lids and conjunctiva, and rarely systemic cholinergic side effects. Drug interactions include decreased effectiveness with ophthalmic NSAIDs and cyclopentolate, enhanced cardiac conduction abnormalities and bronchoconstriction with beta blockers, and increased adverse reactions with acetylcholinesterase inhibitors like Neostigmine, Pyridostigmine, etc. One of the brands available is Carbachol, that is Carbachol injection from Novartis Ophthalmics. So this information is about Carbachol. Now the next drug is Bethanechol. Friends, now let's see important facts about Bethanechol. Bethanechol is a parasympathomimetic drug that selectively stimulates muscarinic receptors. It has no action on nicotinic receptors. It increases tone of detrusor muscle, producing a contraction in the urinary bladder to initiate urination. It also stimulates gastric motility, restores impaired rhythmic peristalsis, and increases gastric tone. Its absorption from the GI tract is poor. Its onset of action is 30 to 90 minutes and its duration of action is approximately 1 hour. It is indicated for urinary retention and its oral adult dose is 10 to 50 mg to be taken 3 to 4 times daily. Contraindications. It is contraindicated in intestinal or urinary obstruction, recent myocardial infarction, pronounced bradycardia or hypotension, recent intestinal anastomosis, hyperthyroidism, peptic ulcer, latent or active bronchial asthma, vasomotor instability, coronary artery disease, epilepsy, Parkinsonism, lactation, etc. Patients should be instructed that this drug may impair ability to drive or operate machinery. Adverse reactions. Adverse reactions include abdominal cramps or discomfort, belching, diarrhea, intestinal colic, malaise, salivation, urinary urgency, headache, hypotension, vasomotor response, hot flushes, sweating, lacrimation, meiosis, seizure, nausea, vomiting, sweating, etc. Drug interactions. It has drug interactions with ganglionic blockers. Critical fall in blood pressure, usually preceded by severe abdominal symptoms, may occur when used with ganglionic blockers. Brand. It's one of the brands available is Uroid in tablet form from Cipla. So this is the information about Bethanechol. Now the next drug is Pilocarpine. Friends, now let's see important facts about Pilocarpine. Pilocarpine is a directly acting parasympathomimetic drug. It is indicated for dry mouth after radiotherapy, for malignant neoplasm of the head and neck, and its oral adult dosage is initially 5 mg TID. If necessary, increase dose gradually after 4 weeks until adequate response is achieved. Maximum dose is 10 mg TID. Reduced dose in case of hepatic impairment. Next indication is Sjogren's syndrome for dry eyes and mouth. Its oral adult dose is 5 mg 4 times daily. Maximum 30 mg daily. Stop treatment if no improvement after 3 months is observed. The tablets may be taken without food. The oral absorption of pilocarpine is decreased with high-fat milk. It is also indicated for open-angle glaucoma. As pilocarpine HCl or pilocarpine nitrate in adults instill a 0.5 to 4% solution into affected eye up to 4 times daily, adjusted according to response. Contraindications. It is contraindicated in conditions where pupillary constriction is undesirable. For example, acute iritis, acute oitis, anterior oitis, and some forms of secondary glaucoma. Also, it is contraindicated in acute inflammatory diseases of the anterior segment, clinically significant uncontrolled cardiorenal diseases, uncontrolled asthma, COPD, and other chronic diseases at risk for cholinergic agonists. It is not to be used in patients wearing soft contact lenses. This drug may cause miosis, which may lead to blurred vision and difficulty with dark adaptation. Do not drive or undertake hazardous tasks in poor illumination. Adverse reactions. Ophthalmic adverse reactions are blurred vision, Brovec, ciliary spasm, conjunctival vascular congestion, lens changes, myopia, ocular burning and itching, vitreous hemorrhage, pupillary block, etc. Oral adverse reactions are influenza-like symptoms, rhinitis, conjunctivitis, constipation, diarrhea, nausea, vomiting, flatulence, dyspepsia, dizziness, flushing, headache, palpitation, increased urinary frequency and urgency, lacrimation, pruritus, rash and sweating. The brands available are Pilomax, that is available as film-coated tablet from Sun Pharmaceuticals, and Carpinol eye drop from Sunways. So this is the information about pilocarpine. Now the next drug is Cevimeline. Friends, now let's move to the next drug, Cevimeline. Cevimeline is a muscarinic agonist having high affinity for M3 muscarinic receptors on salivary and lacrimal gland epithelia. Cevimeline has a long-lasting cytologic action. It is indicated for dry mouth associated with Sjogren's syndrome. Its oral added dose is 30 mg 3 times a day. It may be administered with food to decrease GI upset. It has high apparent volume of distribution. It is metabolized by liver, cytochrome P450, 2D6 and 3A4. It is contraindicated in glaucoma, iritis, asthma, bronchitis, cardiac diseases, angina, myocardial infarction, cholelithiasis, nephrolithiasis, etc. Adverse reactions are visual impairment, abdominal problems, myocardial infarction, pulmonary embolism, bronchospasm, hearing loss, ocular hemorrhage, mania, vaginal bleeding, etc. Drug interactions with beta blockers, it may cause conduction disturbances in heart. Drugs which inhibit CYP2D6 and CYP3A3 or CYP3A4 inhibit cevimeline metabolism. In the prescriber's digital reference, popularly known as PDR, a list of about 180 drugs has been given which may interact with cevimeline. One of the brand of cevimeline is Cevimeline in capsule form from Sun Pharma. So friends, this is the information about cevimeline. Now the next drug is Neostigmine. Friends, now let's move to the next drug, Neostigmine. Neostigmine is indirectly acting cholinomimetic drug. It is reversible cholinesterase inhibitor. Neostigmine inhibits the enzyme cholinesterase and prevents the metabolism of acetylcholine and thus increases the amount of acetylcholine at the receptor site. It also has direct cholinomimetic effect on skeletal muscles and autonomic ganglia. Neostigmine is used in the treatment of myasthenia gravis, paralytic ileus, post-operative urinary retention, and reversal of effects of skeletal muscle relaxant after surgery. Its oral dose as Neostigmine bromide tablet is 15 to 30 mg and parenteral dose as Neostigmine methyl sulfate is 0.5 to 2.5 mg by intramuscular or subcutaneous route. Its onset of action after oral administration is 1 to 2 hours and after intramuscular administration 20 to 30 minutes. Its duration of action upon oral administration is 2 to 4 hours and upon intramuscular administration 2.5 to 4 hours. Its oral absorption is very poor. Its oral bioavailability is approximately 1 to 2% only. It is contraindicated in peritonitis, mechanical, gastrointestinal or urinary obstruction. Special precautions should be taken while administering neostigmine in patients with bronchial asthma, cardiovascular disorders, peptic ulcer disease, vagotonia, epilepsy, Parkinsonism, hyperthyroidism, and renal impairment. Adverse reactions include nausea, vomiting, increased salivation, diarrhea and abdominal cramps. Hypersensitivity reactions such as anaphylaxis, urticaria, angioedema. In high doses of intravenous preparations, neuromuscular dysfunction may be there. Respiratory failure due to a combination of muscarinic, nicotinic and central effects or cardiac arrest may occur. Drug interactions. It may potentiate neuromuscular blockade with depolarizing muscle relaxants such as succinylcholine resulting to prolonged apnoea. Drugs such as aminoglycosides, clindamycin, colistin, cyclopropane, halogenated inhalational anesthetics possessing neuromuscular blocking activity may antagonize the effects of neostigmine. Drugs such as quinine, chloroquine, hydroxychloroquine, quinidine, procainamide, propafenone, lithium reduce the effects of neostigmine. With beta blockers, prolonged bradycardia may produce. The brands available are myostigmine injection from Neon Labs and Tilstigmine 15 mg tablet from Tablets India Limited. Friends, this is the information about neostigmine. The next drug is pyridostigmine. Friends, now let's see some important facts about pyridostigmine. Pyridostigmine is similar to neostigmine in its action and structure. As compared to neostigmine, it is less potent, but it has slightly longer duration of action. It is less potent, that means it requires larger dose than neostigmine to produce the same effect as that of neostigmine. It has slightly longer duration of action, that means the frequency of dosing will be less as compared to neostigmine. To treat myasthenia gravis, dose is as pyridostigmine bromide 60 mg tablet 1 to 3 tablets TDS. Pyridostigmine sustained release tablet containing a total of 180 mg, out of which 60 mg is released immediately and 120 mg over several hours. The duration of action of this sustained release tablet is 6 to 8 hours. Sustained release tablet should be limited to use at bedtime. The dose of pyridostigmine injection 1 mg per ml is 1 to 5 mg intramuscular or subcutaneous. Available brands are Distinone tablet 60 mg from Summer Life Sciences Private Limited and Gravitor sustained release tablet 180 mg from Sun Pharmaceuticals India Limited. This is the information about the pyridostigmine. Friends, in this sixth part of the online lecture series on drugs acting on ANS, we studied therapeutically used parasympathomimetic drugs. In the next lecture, we shall discuss parasympatholytic drugs. Friends, if you like the contents of this lecture, then please give us a like and subscribe to the channel Pharmalife Academy. Friends, thank you very much for watching this lecture. Now, we will meet in the next lecture. Till then, enjoy pharmacology.